Rich. Joining me now is Dr. Seiji Hayashi. He's the Chief Transformation Officer and Medical Director at Mary's Center in Washington, D.C. And Dr. Hayashi, we've heard about the dwindling supply of personal protective equipment. In case in point, I just got my face mask that I ordered in early March. It just came in the mail today. So that just gives me a sense personally of the backlog of supplies, including ventilators as well. It's not something doctors are necessarily used to. What's it like? What are you seeing?
So I'm a primary care doctor at a community health center, and we serve some of the most vulnerable patients in the Washington, D.C. area. We serve about 60,000 patients, and in order to conserve our personal protective equipment, such as these masks that we're talking about, and these aren't even the N95 masks that we really need when we're treating patients who are actively sick. And we have had to wait for our supplies and really conserve them. So we actually went about 80% virtual in terms of our care. We have about 60 providers who are working for Mary Center, but the vast majority are now working online, and so that we can conserve our N95 masks, our gowns, our face shields, and whatnot. And so, and the supplies are beginning to come back, but it is really hard to predict whether we can last a week, 2 weeks, or more.
Yeah, I can just about imagine. So when ventilator supplies get drastically low, who makes the decision about which patients get a ventilator or whether you have to go to splitting patients on one ventilator? How does that work?
Well, I'm not a hospitalist or an ICU doctor. I'm a primary care doctor, so I'm really not the best person to answer questions about how ventilators are used and how it is disseminated to the units, as well as which patients get them. So I'm sorry, I can't answer that question.
When you see a patient in your practice, though, and they're obviously showing some symptoms, you send them off to a hospital, right? If they're really in an acute stage, and do you have to track them at some point, right?
Yeah, we do. We have begun testing here at Mary Center back in March 18th. And when patients, most patients don't want to go to the hospital, and we discourage patients from going to the hospital because it would overwhelm their system. We're doing our best in the primary care setting to actually see our patients in the clinic. We first screen them over the phone to see how they are doing, and asking the questions about fever, cough, body aches, and difficulty breathing. If we think that we need to see them, we will ask them to come to our respiratory clinic, which is separated from our regular clinic. We will do the tests on site and also decide whether this patient can be monitored and cared for at home, or we need to send to the hospital. Over this past week and a half, I've already sent 3 people to the hospital because I didn't think that they would do well at home. And all
Yeah,
3 have been admitted to the hospital.
got it. And you've been active and vocal on Facebook throughout this pandemic, and you described the impact that improved testing is having on controlling the outbreak, or at least could have on controlling the outbreak. What do you think needs to be done to make more testing happen?
I do think that we need to follow the lead of countries like South Korea and make testing much more widely available. If we don't know who has it, there's no way to prevent it, especially now that we're finding out that a large percentage of people who are infected may not be showing any signs or symptoms. That's very concerning. And especially when we think about the communities that we serve, mostly immigrant and low-income individuals and families, they live in very small, tight areas. Many numbers of people within a single household. Sometimes we hear about multiple families living in one house, sharing different bedrooms. And in that kind of setting, if you don't know who has it, it's going to spread very quickly.
Right. And also, are you seeing, we keep hearing about the symptoms being different and maybe not asymptomatic in some patients. Are you seeing sort of like a common thread of symptoms in your practice? Is it the cough that is the most prevalent, or is it the fever? What are you seeing more of?
I think that we still see the common symptoms of cough and fever the most. And I believe that the data will show that, the majority of patients do have those too. But we are seeing other things, such as diarrhea, nasal congestion, body aches, and just feeling, tired and fatigued. And so it's very difficult for us clinicians to rule out anybody with different signs and symptoms. We've been hearing reports about, not being able to taste or not being able to smell as being common signs and symptoms of the coronavirus.
Right. Well, we are in awe of the work that you and other medical professionals are doing to try to slow this outbreak and treat people as they get sick from this terrible virus. We thank you for joining me, Dr. Seiji Hayashi, and stay safe.
Thank you very much.